Okay, there are 98 questions on this test. Are you ready? Okay. Is that yours, Jonathan?
I got you.
Okay, here we go. Number one. Which of the following terms is defined as using the correct amount of a drug according to the manufacturer's guidelines? What is the most appropriate pharmacologic intervention for a patient that presents with an altered mental level of mentation, cool and clammy skin, and a blood glucose level of 40? A paramedic is preparing to administer glucose to a patient with a history of alcohol abuse. Which of the following pharmacologic agents should be administered before the glucose? What is the generic name for Demerol? Atropine affects the parasympathetic nervous system by which of the following mechanisms? Benadryl has some anticholinergic properties that may produce which of the following adverse effects? Norepinephrine has the greatest affinity for which of the following receptor sites? What is the effect of the parasympathetic stimulation to the heart? From the following list, choose one of the undesirable effects of a non-selective adgeneric drug. Which hormone released from the adrenal medulla stimulates beta-2 receptors in the lungs to promote bronchodilation? Which of the following classification of pharmacologic agents would be appropriate for the treatment of pulmonary edema? Which of the following is classified as an coagulant? Somebody pronounce it for me. Coagulant. Thank you. Which of the following medications is commonly used during hemodialysis to prevent the formation of blood clots? Which classification of medication is designed to dissolve clots after their formation? Atropine is classified as which type of drug? Which of the following responses would you anticipate in reaction to stimulation of the beta receptors by administration of albuterol? What are the primary actions of the xanthine drugs? Which of the following statements best describes how loop diuretic agents function? Ingesting too much of a substance that has the potential to cause which medical condition? Activated charcoal works through which of the following processes? What is the mechanism of action of an emetic? Zantac, Tagamet, Pepsid all work because of their antagonistic action at what receptor site? Which drug stimulates the liver to break down glycogen? Which of the following is the primary hormone that regulates glucose metabolism? Urocorticoid drugs may be used to treat which of the following medical conditions? Which of the following drugs would be the most correct pharmacologic agent to treat with a patient with a suspected morphine overdose? Which of the following pharmacologic agents would be used to premedicate a patient before transcutaneous pacing? Which of the following terms best describes the use of activated charcoal for a patient with an ingestion of a corrosive material? Paramedic is on scene with a patient who presents with vomiting, hyperpenia, hyperactivity, seizures after an ingestion of non-prescription medication. The most likely cause of this patient's signs and symptoms is what type of overdose? Which of the following statements about NSAIDs is most correct? Ibuprofen and naproxen, sodium are examples of what type of medications? Morphine and Demerol examples of what type of medications? What are the most common adverse effects of narcotic administration? Myrfidine hydrochloride would be contraindicated in which situation? Which of the following drugs are opioid agonist? Which of the following drugs should be administered to a patient who has ingested a large dose of morphine? How many basic levels of cessation have been identified? Which of the following statements is most accurate when referring to stage 4 anesthesia? What is the most common route of administration for etomidate? Procaine is an example of what type of anesthesia? Ketamine is an example of what type of anesthesia? Which of the following anesthesics are commonly used in the field for rapid sequence intubation? Hep A and B, rabies, rubella are examples of what type of immunization? Tonsillitis, dental infections, otitis media, sinusitis are commonly treated with what type of antibiotic? How do cephalosporins differ from penicillins? Antiplasic agents are used to treat what type of medical conditions? Antineoplastic agents have which side effect? Pantothenic acid and calabium are examples of what type of medication? Vitamin A, D, E, and K are examples of which type of vitamins? What type of drugs would be indicated for administration to an actively seizing patient? Which of the following drugs are classified as benzodiazepines? Which of the following drugs would be used to reverse the effects of chlorodiaz peroxide or epoxide? Which of the following drugs would be used to control seizures? Parafontate and methocarbamol are examples of what type of medications? Which of the following commonly used drugs is used to suppress hunger and is often abused? Atropine is an example of which class of drugs? Atropine is commonly used to treat which of the following conditions? Which of the following is one of the trade names for norepinephrine? Which of the following is a special consideration with regards to the use of norepinephrine? Which of the following statements is most correct with referring to a symptomimetic? Which of the following cardiac problems would be treated with lidocaine? Lidocaine would be contraindicated in which of the following rhythms? Low pressure is an example of which type of drug? Amiodarone is indicated for the treatment of which following? What is the trade name for diltiazem? Diltiazem is contraindicated in which of the following? Rapamil is classified as which type of drug? Which of the following drugs would be most appropriate pharmacologic intervention for the symptomatic patient experiencing SVT with a heart rate of 220 beats a minute? Which of the following adverse effects may occur with the use or administration of DIG? Rauwolfin derivatives come from which of the following sources? Diazotide and minoxidil are classified as which type of drug? Patients who take loop diuretics are at risk for which of the following adverse effects? What is the generic name for Lasix? Aldactone is an example of which type of drug? Which of the following drugs is the most appropriate antiplatelet therapy for a patient with a previous stroke? Lopid is commonly used as a pharmacologic treatment for which of the following conditions? Hydroxyzine and promethazine are classified as which type of drug? Which of the following is an adverse effect from administration of diphenhydramine, Benadryl? Diphenhydramine. Which of the many of the over-the-counter drug syrups contain which of the following expectorants? Albuterol is often used as a pharmacologic intervention in which of the following medical conditions? Ipotropine bromine is classified as which type of drug? What is the trade name for amorphine? Simethicone drops are used to treat which of the following medical conditions? What class of drugs is used to treat seasickness? Which of the following is an example of an emetic drug? Which of the following drugs would be the proper pharmacologic agent for a patient with peptic ulcers? Diamox and timolol are used to treat which of the following medical conditions? Synthroid is used to treat what problem? The proper pre-hospital management of a hypoglycemic patient may include administration of which of the following medications? Solumetrol and Solucortef are classified which type of medication? What are the side effects of colchicine, colchicine administration? What is the desired effect of Depo-Provera administration? Let's see. Xanthopine and cyclopine are classified as which type of drug? How are dermatologic medications administered? What pharmacologic agent is most appropriate for a treatment of a patient with a organophosphate poisoning? What term is used to describe the use of a drug when it is not advisable? What term is used to describe the appropriate use of a drug to treat a condition? The trade name Lipitor is an example of what of the following? And that is 98 questions. Now, this is for Cell. This is the answers.